The NHS Long-Term Workforce Plan encourages the use of technology to reduce admin time to allow greater focus on patient care, increase flexibility in workforce deployment, and work more efficiently. The NHS Digital Staff Passport supports the long-term workforce plan by enabling faster and easier movement of NHS staff between NHS trusts. The service will be made available to over 200 NHS trusts, governed by over 40 integrated care boards, also known as ICBs, across 7 regions. The initial focus of the service supports temporary movers and postgraduate doctors in training, with a view to all NHS staff accessing the service in time. ICBs are preparing to implement the NHS Digital Staff Passport as part of the National Incremental Rollout Programme. Rollout will be driven by a system approach to ensure multiple NHS trusts in an area are supported to implement the NHS Digital Staff Passport at the same time. Trusts will be supported to prepare for implementation by their ICB workforce leads, backed up by resources from the NHS Digital Staff Passport team. The system approach can be defined in 3 ways. Full system, with each NHS trust ready to implement at the same time. Part system, with several NHS trusts implementing initially, followed by other NHS trusts when ready. Network-based, with implementation at NHS trusts across system boundaries to meet the demand of a local or regional clinical or operational network, or support rotational trainees moving across system boundaries as part of their training programs. The chosen option will depend upon service demand, ICB priorities, and trust resources. Benefits of the system approach are regional visibility of service demand for NHS Digital Staff Passport within and across NHS trusts, a standardised approach to implementation driven by ICB priorities, expert team leads within and across NHS trusts working together, increased value to NHS staff who will be able to access the service within a local area and nationally, and consistent engagement with all key stakeholders supporting service implementation. The NHS Digital Staff Passport team will work closely with regional and ICB workforce leads to identify where the service can be implemented in a system approach. To support NHS trusts with signing up to the service, an implementation assessment has been developed in partnership with the NHS Digital Staff Passport team, regional workforce leads, ICB workforce leads, and NHS trusts. The implementation assessment is available via an online portal to ensure efficiency and support NHS trusts to complete the necessary stages. This portal will also allow regional and ICB workforce leads visibility of readiness for each NHS trust in their respective areas. When undertaking the implementation assessment, key stakeholders at NHS trust level will state intention and readiness to proceed based on eligibility criteria. Once a completed implementation assessment has been submitted, the NHS Digital Staff Passport team will support the NHS Trust and ICB workforce leads to implement the service in line with other trusts within the system. Trusts and systems will then be supported to adopt and embed the Passport service to deliver significant benefits for our workforce and the populations we seek to serve. For further information about the system approach and to check which NHS trusts are already registered, please visit the NHS Digital Staff Passport website.